Your rings feel tight by 6 o'clock. Your socks leave a red line across your ankle that takes 10 minutes to fade. That's not fat. That's roughly a pint of fluid parked in your lower legs because gravity won today. But there's a reason doctors in Japan have people lie flat on the floor, throw their arms and legs into the air, and shake them like a bug on its back for 30 seconds. Not a supplement, not a fad. It targets the exact pump moving that fluid. And by the end, you'll know how to use it tonight. It's called Gokiburi Taiso, the cockroach exercise, and it's been passed around Japanese wellness circles for decades. The kind of thing a grandmother teaches a grandchild instead of a doctor teaching a patient. A version of it went viral again a couple years back after a single post on Japanese social media picked up tens of thousands of shares, mostly from people who stand or sit all day and swore their ankles look normal again by morning. Physical therapists in Japan still recommend it for circulation the same way they recommend a hot bath for a stiff back. Nurses use it between shifts. Flight attendants use it in the crew rest area on long hauls. And when you look at what it's actually doing to the veins in your legs, the enthusiasm makes more sense than it sounds like it should. This isn't a lymphatic massage oil or a $40 roller, just gravity and a muscle you already own, used correctly for once. Here's what's actually happening when your ankles puff up. Blood has to travel from your feet all the way back up to your heart, uphill, against gravity, through veins that only push one direction. Standing still or sitting for hours doesn't just fail to help that trip, it shuts down the one thing built to power it. Your calf is sometimes called the second heart, and that's not a cute nickname. Every time your calf muscle contracts, it squeezes the deep veins running through it, and that squeeze pushes blood upward through a series of one-way valves toward your heart. Researchers estimate the calf pump provides roughly half the total force behind venous return in your legs. Walk for 10 minutes, and that pump fires with every step. Sit at a desk, stand at a register, or fly economy for 6 hours, and the pump goes quiet. Blood pools, pressure builds in the vein walls, and once that pressure gets high enough, fluid starts leaking out of the vessels and into the soft tissue around your ankles, which is the actual swelling staring back at you in the mirror. It's rarely water retention from salt. It's plumbing that stopped running. Press a finger into your shin right now if you're at that point in the day and watch how long the little dent takes to bounce back. That dent is fluid sitting exactly where gravity and an idle pump left it. So why not just do calf raises at your desk instead of lying on the floor? You can, and it helps some, but standing calf raises are still fighting gravity the whole time, pushing fluid up a hill that never levels off. Lying down and lifting your legs above your heart removes the hill entirely. Gravity stops being the enemy and starts doing the draining for you. And the shaking on top of that keep the calf and foot muscles firing the same way walking would, except there's zero weight on your knees or your lower back while it happens. That combination, elevation plus muscle pumping, is why physical therapists teaching lymphedema patients use almost the identical setup, just gentler and slower. Here's how to actually do it. Lie flat on your back, ideally on a bed or a rug, somewhere your limbs can go straight up without hitting a wall. Lift both legs and both arms toward the ceiling, as close to vertical as your hips and shoulders allow. Now shake them. Small, loose, rapid movements. Hands and feet flopping like you've lost control of them completely. 30 to 60 seconds is plenty. That's the whole move. It looks ridiculous, which is probably why it never got dressed up into a spa treatment with a price tag attached. Do it once before bed and your ankles have all night to keep draining while you sleep flat. Do it again first thing in the morning and you're starting the day with a pump that's already prime instead of one that's been sitting idle since dinner. There's one addition that makes it work faster, and it costs 0 extra seconds. Before you start shaking, take 4 or 5 slow breaths through your nose, letting your belly rise instead of your chest. Deep breathing pulls on the same drainage network higher up in your trunk, creating a kind of vacuum that helps pull fluid out of your limbs and toward your chest, the way sucking on a straw pulls liquid up from the bottom of a glass. Physical therapists who treat lymphedema patients start every session with exactly this before any limb movement at all, because the trunk has to have somewhere to drain into before the legs can empty properly. So breathe first, shake second. If a bad back or a stiff knee won't let you fling your legs into the air, there's a seated version that gets you most of the same benefit. Sit with your feet flat on the floor, then alternate flexing your toes up toward your shin and pointing them back down. 20 to 30 reps a few times through the day. Add slow ankle circles after, 10 each direction per foot. It's slower than the full cockroach version, but it runs on the same mechanism, and it's the one nurses and flight attendants actually rely on, because you can't exactly lie on the floor mid-shift. This isn't just an end-of-desk job problem either. Pregnancy pushes on the pelvic veins and slows the same return trip, which is a huge part of why third trimester ankles swell. If you're pregnant, run this by your OB first, since not every position or pressure is automatically fine late in pregnancy. But the gentle seated version is usually the one cleared without a second thought. Long flights do the same thing through hours of sitting and cabin pressure, which is exactly why the seated ankle pumps show up in almost every airline safety card if you actually read the fine print instead of skipping to the exit rows. And it gets more relevant with age, not less, because vein valves loosen slightly over the decades the same way any one-way door loosen after enough use. So the pump that was doing 50% of the work at 25 is doing less of it by 60 unless something keeps training it. That's the whole reason this move outlasted whatever wellness trend was popular the year it started. It isn't chasing a demographic. It's fixing a mechanism everyone eventually runs into. The most common way people waste this move is holding the shake instead of doing it. A tense little wiggle for 5 seconds doesn't fire the calf muscle enough times to matter. You want loose, floppy, almost silly for the full 30 seconds, not a stiff flutter you quit after 3. The second mistake is skipping the elevation and just shaking your legs while they're still down by your side. Without the height, gravity is doing nothing for you, and you're left with the muscle pump alone, which still helps, just far less. Height first, shake second. Both together is the whole point. The third mistake is doing it once and expecting it to stick. This isn't a one-time fix any more than brushing your teeth once fixes your teeth for a month. Your legs refill with fluids the next time you stand or sit for hours because of the underlying reason. Gravity plus an idle pump is still there tomorrow. Treat it like a nightly reset, not a cure. Here's where it actually beats the 2 things everyone tells you to buy. Diuretics pull fluid out through your kidneys, and they're a prescription for a reason, because you're changing your body's salt and water balance on purpose. That's a medication with real side effects for people who have an actual medical reason to take one, not a nightly ankle fix. Compression stockings work differently. They squeeze the fluid back in from the outside, and research on standing workers found a lighter compression range, somewhere around 10 to 15 millimeters of mercury, does the job about as well as the stronger, pricier ones. But stockings only manage the symptom while they're on your leg. Take them off, and the pooling starts right back up the second you sit down. The muscle pump approach is the only one of the three that actually restarts your own circulation instead of borrowing help from a pill or a piece of fabric. It won't fix a real vein problem. But for the ordinary gravity and a long day kind of swelling, it's addressing the pump itself, not the fluid sitting downstream of it. Quick myth while we're here. Cutting back on water to stop swelling does the opposite. Your body holds onto fluid harder when it thinks water is scarce, which is the same reflex that makes you retain more after a salty meal followed by not enough to drink. Staying properly hydrated actually makes it easier for that pint of fluid to move where it's supposed to go instead of getting parked in your ankles. Salt matters more than water does. Cut the sodium on a bad swelling day before you cut the glass of water. Now, the part that actually matters more than the exercise. Not all swollen ankles are the boring kind. If it's in one leg only, especially with calf pain, warmth, or skin that's gone red or strangely tight, stop and get that looked at, because that's the pattern doctors associate with a blood clot. And a clot doesn't wait for you to finish your evening routine. Press a thumb into the swelling. If the dent is still sitting there 2 or 3 minutes later, that's a more advanced grade of fluid buildup, worth a conversation with a doctor rather than a home fix. Swelling that never goes away overnight, even after you've slept with your legs elevated, can be an early sign of a heart, kidney, or liver issue, because organ-related fluid retention often shows up in the feet and ankles before anywhere else. None of that means panic every time your shoes feel tight after a wedding where you stood 4 hours in heels. Most evening ankle swelling truly is exactly what it looks like: a long day, gravity, and a lazy calf pump. But your body is telling you something specific with where and how it swells, and the smart move is knowing which pattern you're looking at instead of assuming 30 seconds on the floor fixes everything with a pulse. This is basically the same principle behind a lot of what actually works long term, not just for ankles. The joint pain that flares after sitting too long, the blood sugar swing after a meal you never move off, the blood pressure creep that shows up after a decade at a desk, all of it traces back to one idea. Your body already has pumps and system built in, and they only work if you actually use them. The cockroach exercise is just the oddest, smallest example of it. The one you can run in your bedroom in under a minute, still built on that same principle. People go hunting for the supplement or the gadget first. The actual lever was already installed in your legs before you were born. So tonight, before you reach for anything else, try the 30 seconds. Legs up, arms up, shake it out. Check your ankles again by the time you're brushing your teeth. It costs nothing and takes less time than picking what to watch next. The real question is why something this simple isn't the first thing anyone tells you instead of the sock aisle or a prescription pad. Maybe it's because there's no product to sell at the end of it. Or if your legs have been doing this every single evening for months, that's worth actually mentioning to a doctor, not just shaking away. Nobody's selling this to you. There's no company behind Goki Burutaiso, no affiliate link, no bottle to restock, just a physical therapist somewhere in Japan who noticed a muscle pump and a bit of gravity outperform whatever was on the shelf. If you want the next one of these, the odd but legit fix for the ache in your knees or the blood pressure creep, that's already waiting for you.